Dr. Vashita Hemant Vasantapuram. She's from Bangalore in India. She is a consultant ophthalmic plastic surgeon who is currently practicing at LV Prasad Eye Institute in India. She completed her MBBS from Vijayanagar Institute of Medical Sciences, Bellary, in 2013. She later went on to do her master's in ophthalmology from the prestigious Postgraduate Institute of Medical Education and Research, Chandigarh, in 2017, where she was awarded a bronze medal. She later went on to do a plastic surgery and ocular oncology from LV Prasad Eye Institute, India, from 2018 to 2019. She has published a few papers in peer-reviewed journals and a few book chapters. The doctor is also privileged to have had an opportunity to present at several conferences locally, nationally, as well as internationally. She has a special interest in pursuing research in thyroid eye disease and imaging, which is specific to the eyelid. Dr. Vasantapuram has hobbies as well, which include painting, sketching, cooking, and traveling. So with this brief introduction, please help me to welcome Dr. Vasantapuram to this week's Journal Club. And thank you very much, Doctor, for finding time to be with us today.
Thank you so much for that humble introduction. It's actually an honor for me to be able to interact with all of you. I hope the session will be fruitful. Thank you.
Thank you. And our speaker for today is Dr. Judith Chupa. She is a third-year registrar at Kito Teaching Eye Hospital. Dr. Chupa, we are ready for your presentation.
Thank you, Dr. Chansa. Let me just try and share my slides. Can we see my projection?
Yes, we can.
Okay, just a minute. Okay, good afternoon, everybody. As you all know, my name is Dr. Judith Chupa, STP3 registrar at Kito Teaching Eye Hospital. And as you all know, my moderator is Dr. Vashita. So today's topic is quality of life in thyroid eye disease, which is a systemic review. Okay. So in my introduction, so thyroid eye disease is basically a very common orbital disorder. It's an autoimmune inflammatory disorder involving the soft tissues of the orbit. Then it's the most common cause of axial exophthalmos with a predilation for females. Then most patients are hyperthyroid at presentation. Then in most cases, they're associated with euthyroid or hypothyroid status. Under epidemiology, so thyroid eye disease occurs in about 5 times more frequently in women, then with an incidence of about 16 people per 100,000 in women and 3 per 100,000 in men. Then the age of presentation is bimodal, with the peak incident rates occurring in the ages of 40 to 44 years and 60 to 64 years. Then the risk factors. So the first common risk factor is smoking. And smoking happens to be the most important modifiable risk factor that there is. The use of tobacco, also the genetics predilation, the type of treatment used for hyperthyroidism, for example, radioactive iodine, the use of drugs, for example, amiodarone, cytokines, interleukins, all these can predispose a patient to getting thyroid eye disease, and also advanced age. Clinical features. So thyroid eye disease typically proceeds through a congestive stage, which is the inflammatory stage, and then it proceeds with a fibrotic or quiescent stage. Then in the clinical presentation, it can present with about 5 stages, where we have the first stage, it could have soft tissue involvement, where we can see, like in the first picture, where there's periorbital and lid swelling. It can present with lid retraction, where a patient could have a staring kind of look. We can also have proptosis, restricted myopathy, and lastly, optic nerve neuropathy. And under the classification according to severity, we've used the UGOGO classification, which is the European group of graves of ophthalmopathy. So in the first degree, which is mild stage, it's with only a minor impact on daily life. So we may not see so much of signs on the patients. So in the second degree, we have moderate to severe, with one of moderate to severe soft tissue involvement. It could be lid retraction of about 2 millimeters or more, diplopia or proptosis of about 3 millimeters or more. Then in the third stage, which is the last one, it could be sight threatening due to optic neuropathy or corneal breakdown. So in our, just a minute. In our article, basically we're looking at the quality of life. So we want to understand certain terminologies or certain definitions that we'll be dealing with. For instance, the health-related quality of life. So what is it? So it is defined as the physical, psychological, and social domains of health as perceived by the patient, which are influenced by patient's experiences, beliefs, and expectations of their disease and treatment. Then health-related quality of life are among the best predictors of the use of general medical and medical health services, as well as strong predictors of mortality. So what is quality of life and why is it necessary? So quality of life is basically an integral part of a holistic evaluation of patients afflicted by a disease. So it's necessity. It's patient-centered outcome in healthcare. It measures an individual's goals and personal concerns. It adds the patient's perspective to the doctor's objective assessment. It can also aid in improved client satisfaction. Then why quality of life is helpful in management of patients with thyroid eye disease. So basically, quality of life helps identify the threshold for intervention. What type of surgery are you going to, or what type of treatment are you going to administer to a patient in this case? Then quality of life in thyroid eye disease is important as it helps improve patient care. It's also an indicator of treatment efficacy, and also it provides a better evaluation of impact of disease on patient's life. So today's article is on quality of life in thyroid eye disease. Like I said, it's a systematic review that we'll be doing. And our objective today is to understand the components of the quality of life and questionnaires.
Even done said.
And an up-to-date insight of the types of quality of life questionnaires that are available. We need to talk about their strengths, their limitations, based on current literature. So the study setting, so it was a multi-center review, which reviewed about 27 articles that fitted the pre-specified criteria. And these studies were done in 2 universities. That's the Monash University in Malaysia and the National University of Singapore. And the time of study was from the 18th to the 21st of February, 2019. The methodology that was used, like I said, it was a systematic review that used about 6 major databases, which is the Cochrane Library, the Ovid Medline, PubMed, Scopus, Taylor and Francis, and lastly, Web of Science. So the inclusion criteria and the exclusion criteria were defined. So the inclusion criteria was in two things. There was impact of quality of life and the quality of life questionnaires. Under impact of quality of life in thyroid eye disease or graves of thermopathy, the articles had to be in English only, no time limits in terms of publications. Then there was physical and psychological and social implications in those had to be in English only, no time limits as well, applicability of quality of life questionnaires to local populations. Then it had to be valid and reliable, and it had responses of responsiveness of quality of life questionnaires. Under the exclusion criteria, thyroid eye disease, graves of thermopathy, thyroid associated ophthalmopathy, orbitopathy, quality of life as a measure of efficacy of interventions like orbital decompression and IV methylprednisolone were excluded. Quality of life relating to thyroid disease in general, for example, Graves' disease or hypothyroidism were also excluded. Any study that had a foreign language was excluded other than English, and letters to editors regarding studies relating to the quality of life of thyroid eye disease patients were also excluded. So in the results, like we said, so they had about 402 studies that were picked, and because most of the studies were not fit into the criteria, they had to narrow the papers down to 27. Some of the papers had duplicates, that's why they could not use them, and others were falling under the exclusion criteria. Okay. So how does one judge whether a questionnaire is valid and reliable? And how does one judge that it makes sense and it can be applied in a clinical practice, either for research or just to assist in patient management? So there are two tools that these questionnaires undergo. They have to be validated and they have to be reliable. So you want to get to understand what these terminologies are or what these tools are using. So basically there's validity. Validity has other factors that make it valid. That's content, it's criteria, it could be longitudinal, it could be contrast, and under construct, it's further divided into convergent and discriminant. So what is validity? Validity is basically just a process of determining whether the instrument measures what it is intended, okay? Then what is content validity? Content validity basically focuses on whether the item is sensible and it reflects the intended domain of interest. Then under criterion, it's whether a scale shows an anticipated correlation with the external criteria. Then under longitudinal, it could just detect the change in the health status over time. Then construct validity is basically how well an instrument measures its intended construct, which could be convergent or discriminant. Then the types of reliability. Like we said, reliability is basically consistency of a measure. So it could be using test, retest, or internal consistency, or inter-rater. And we need to define these ones as well. So test, retest is basically the same test given several times on the same group. And basically we are hoping to get the same type of results all the time when we test with those same tests on the same group of people. Then there's internal consistency. Internal consistency is basically consistency of people's response over a period of time as well. Then inter-rater reliability is a score of consistency in ratings given by the same person across multiple times. Then you want to know, so what are the types of the questionnaires that there is? So there's the general health questionnaire, then there's the semi-structured interviews, then there's vision-specific questionnaire, and lastly, the disease-specific quality of life questionnaire, which we're going to be basing our discussion on. So the disease-specific quality of life questionnaire consists of the Graves of Ophthalmopathy quality of life, the Thyroid Eye Disease quality of life, and the Graves of Ophthalmopathy quality of life scale, and lastly, the Singapore Thyroid Eye Disease quality of life. So let's now get into the discussion of our results and the interpretations here. So we now define the general health questionnaire. So it's a screening tool or device we use to identify the minor psychiatric disorders in a general population. So with this questionnaire, we can actually use it in our outpatient department. It doesn't have to be a thyroid eye disease alone. We can use it for all other types of diseases. Its components are basically the somatic symptoms, the anxiety and insomnia, social dysfunction, depression. Then its strengths are that it has good overall assessment of one's quality of life, because it assesses a number of general things on a patient's body as you manage them. Then it allows clinicians to compare the quality of life of thyroid eye disease with other diseases due to its generalizability. Then its limitations are that it's got poor content validity, and it does not recognize clinically important changes which are specific to thyroid eye disease, because it's a general health questionnaire. Then the disease-specific quality of life questionnaire, which we're basing our discussion on, consists of, like I said, Graves of Ophthalmopathy quality of life, Graves orbitopathy quality of life, and the thyroid eye disease, and the Singapore thyroid eye disease quality of life. So under the Graves of Ophthalmopathy, it has only two components which it uses, which is appearance and visual functioning. So it scales all these into grades, and then also Graves orbitopathy has about 4 components. The thyroid eye disease has about 3 components, which is overall quality of life, the daily functioning and appearance. And then the Singapore thyroid eye disease quality of life has got about 3. It monitors activity, psychology, and social domain. So the strengths that we find in the Graves of Ophthalmopathy is that it is the most well-researched and useful study. Then it has positive correlations with the disease severity and activity. Validity and reliability have been done also, and they are positive. Then Graves orbitopathy quality of life, its strengths are contrast validity and structural validity. Whereas thyroid eye disease quality of life is valid also, and it's reliable. It's less time consuming. It takes about 2 minutes to cover it. Whereas when you compare it to the thyroid Graves orbitopathy quality of life, it takes about 3.1 minutes to complete the questionnaire. And then also the strengths in the Singapore thyroid eye disease, it's that its content validity, it's got correlation between the clinician measured outcome and the patient outcomes as well. It's also got 100% response rate. The only limitations are that it's not yet validated. Then it also uses a small sample size, what makes it not so good to use. So here's examples of how the questionnaires look like. The first one, which is consisting of about 16 questions. This is the Graves of Ophthalmopathy quality of life. That's why it takes about 3.1 minutes, very long to complete and slightly complicated for most patients. Then on my right, there's the thyroid eye disease questionnaire. It only consists of about 3 components, and it takes about 2 minutes to complete. And it it has some few animations on it so that patients can be able to understand it easily. Okay. Then the vision specific questionnaire. So basically it assesses the impact of vision impairment on the quality of life. Then it uses the National Eye Institute Visual Function Questionnaire. Its components are visual problems, psychosocial functioning, the interface with daily activity. Then its strengths are that it possesses cultural validity and useful in strabismus-related thyroid eye disease. Its limitations are that it's inadequate in exploring problems related to thyroid eye disease, and it has ceiling effects, meaning it can give you a future or prognosis about your patients. Then semi-structured interviews. These are open-ended, neutral and sensitive questions which are related to the experiences, the emotions, and understanding of thyroid eye disease. Its strengths are its convergent validity. It allows in-depth exploration of the psychological impact of thyroid eye disease on patients' lives. It also allows an individualized assessment of issues, and its limitations are that it needs more validity study. It's a bit time consuming, takes about an hour, and it does not provide direct solutions to problems. Okay, so now let's discuss the results that we have in the tables. So basically, table 1 is a summary of the validity measures of grades of pharmacopathy quality of life. So as we can see, it's a multiple cross-sectional study that has been conducted in about 9 countries. So this basically shows that it has been researched more as compared to the other study that we'll be looking at, the other questionnaire. So it demonstrates its validity by construct and longitudinal validity, where we see that under construct validity, it had a positive correlation with the medical outcome study 24 and the sickness impact profile scale with a p-value of less than 0.5. And in the longitudinal part, that's under the country of Netherlands, it had the congruency between changes in the quality of life and the quality of life associated treatment outcomes. Okay. In the second table, it shows the reliability measures. Basically demonstrates it was reliable using the internal consistency and retest reliability. So basically it is showing that it had high values of coefficient correlation, which were above 0.5 and had positive values. Apart from that, it showed that, basically it was the graves of homeopathy quality of life is the most studied, and it shows that it's both reliable and valid. Then under the thyroid eye disease quality of life, it's also showing that it is valid and it is also reliable. But as we can see, only 3 countries were able to further study it in full and show its reliability and its validity and reliability. And then also what we see is that the overall quality of life questionnaire in thyroid eye disease had a strong correlation with the functioning questions of the thyroid eye disease quality of life and the graves of thermopathy quality of life, meaning that it was able to show some good correlation. If a patient it was able to show whether a patient had undergone surgery or just surgery, rather, if a patient had undergone medical treatment or surgical treatment, it showed that the thyroid eye disease was the best questionnaire to use, and that it gave more insight as to what the patients had or were feeling, or how happy they were with how you treated them. Okay, so it also showed divergent validity, as we can see. And then in the fourth table, it still continues to show longitudinal validity and responsiveness. So here, it all depends on the type of operation that you would want to go for. Is it depression? Is it decompression, strabismus, or palpebral aperture narrowing surgery? So basically, it showed that the use of thyroid eye disease in this case was more preferable than the Graves' ophthalmopathy, because it will show you greater results in terms of feedback for patients. And the fifth table is basically a reliability measure for thyroid eye disease questionnaire, and also it is showing us that it was reliable in that it passed the test of internal consistency and test retest reliability. So these patients were able to be retested over and over again, and they were able to get the same type of results from the same type of patients, making it test retest reliable. And also they use the Cronbach's alpha analysis in terms of internal consistency as they were measuring the questionnaires. So the author's interpretation that the disease-specific questionnaires are the most suitable questionnaires, with the single item questionnaires like thyroid eye disease are ideal in a busy metropolitan hospital because they were only taking about 2 minutes to complete, and they only had about 3 components on them. Then the Graves Quality of Life questionnaire, it happens to be best and most well-researched, with high levels of validity and reliability, and also cultural applicability, only if you have enough time to complete the questionnaires with those patients, because they are time consuming, and they also recorded a higher percentage of incompleteness in terms of patient attendance on them. Now we go into the critiquing part of our article. So the methods that were used, so it clearly stated set of objectives were predefined eligibility criteria for studies. Then the study period was clearly defined. The inclusion and exclusion criteria were defined. The assignment was, it was a systematic literature review. All studies were skimmed by title and abstract, and they came up with 27 studies, which they analyzed. Then there was no restriction to publication period for any study. Assessment, so literature selection and statistical tools were well defined. Then the study question or the aim was answered. Then the results were well described in form of tables, and we also saw the strengths and the limitations which were explored under each questionnaire. So our interpretation from this article is that the quality of life basically depends on the visual function, the appearance, the clinical active score, the age, and also the gender of those patients that they were dealing with. Then treatment, we need to treat the patient as a whole, not only in terms of treating the disease, but address the psychosocial and functional aspects on a patient. Then it is essential to analyze the quality of life before and after management so as to aid in the treatment selection. Then we need to consider the ethnic variations, the cultural differences, and the local practices in assessing the quality of life in an individual population. Then what can we extrapolate from this study? Then available quality of life have been validated on the European or American or Asian relations. Then we need to choose an appropriate disease-specific quality of life for our population based on the type of clinical practice or research. Then conversion of the quality of life in the local language with specific techniques, maintaining the meaning and the significance of the individual questionnaires. Then we need to adopt the use of the quality of life questionnaire usage as we plan for management of thyroid eye disease patients. Then the Graves of Thermopathy quality of life is a promising tool to measure the disease-specific aspects of quality of life in patients with Graves of Thermopathy and provide additional information to psychological or biological measures of health status. Well, that marks the end of my presentation. I'll call Dr. Vashit to take it up from here.
Thank you, dear Judith. It was a very wonderfully presented paper. You really simplified the paper for everybody. So basically what they talk about in this paper is the quality of life questionnaires which are available. All the types of quality of life questionnaires which have been available have been very nicely researched and presented in this paper. Now, when we deal with a thyroid eye disease patient, we have to look at the patient as a whole. So it doesn't end at assessing the severity or the activity of the patient, but we also need to understand that thyroid eye disease is a very disfiguring, it's a very troublesome disease, and it's a long-term disease. Patients, they have disfiguring proptosis, they have strabismus, double vision, and these are very troublesome to the patient to an extent that it affects their daily life. It can affect their psychology, their social behavior, their functionality. So this makes having a quality of life questionnaire to assess the impact of the disease on their life, on the lifestyle, very important. Now, as has been nicely summarized questionnaires which are available. So the authors have very nicely analyzed which is the most useful. Now, when we have questionnaire, it is also important to know the Caucasian population might not be applicable in the Indian population or in any other in an Asian population. So it is specific. The questionnaire, the Graves of Thalmopathy Quality of Life questionnaire, actually the second question which came up, but that is the most popular. So that's really now 8 other groups have validated that in their individual populations. So have noted it either Persian or Korean, Chinese or English, and validated it in their population. So when we have a questionnaire and we want to apply it in our population, again, in order to maintain the means, there are different techniques to conduct our loan. Suppose I have to conduct a quality of life questionnaire in my clinic or in my setup, and my native language is Telugu. So I need to convert, I need to first choose which quality of life questionnaire I need to use, either the GoQOL or the TDQOL, because they have already been validated. Is by the forward backward translation. And this is applicable first in my population. Conduct a quality of life questionnaire. Judith, suppose you have to apply, or suppose you want to conduct a quality of life questionnaire in your setup,
Yes,
in
Dr. Bashir.
your place. So would you consider any different questions which might be something specific to your population or the kind of patients that you see?
Well, depending on the type of clinic that we have, I would want to go for the thyroid eye disease type of questionnaire because we have a very busy clinic and I want to make sure that we finish those questionnaires in a very stipulated short time possible, if that be. And in terms of adding any type of question to it, I would want to find out, apart from vision, function, and appearance function, I would want to know if they're comfortable in terms of, how would I put it? If they're comfortable with just how they look in the public, or in terms of is it affecting them in their day-to-day activities, the fact that they have proptosis or their confidence levels. I would love to add that to know from them how I then manage them after that. And tolerance to pain, if at all they're experiencing any pain. I would add such questions.
Okay, very good. So, and also you should remember that if you want to have the questionnaire in your native language, so that the patients themselves are able to read it, understand it, and answer it in their time. So you need to convert them as well. Okay, you have to translate them basically. So
Yes.
any questions from everyone, I'll be happy to address them. I hope this paper has been simplified, and I hope everyone has got an idea of the quality of life questionnaire, its need, the way it is validated, and how it can be applied. Mumbi, you have any questions?
I don't have any questions for now. I'm traveling. I'm hoping I'll have arrived by the time before the meeting ends. I think, I don't know whether Dr. Vrunda, do you have any contributions or any questions that you can ask?
Not any questions, but maybe just that it's really something that we haven't really put into practice, like in our setting, in terms of quality of life of our patients we're seeing with thyroid eye disease. We're mostly focusing on the clinical presentation, the clinical symptoms, but not really on the quality of life. So it's something that we can add to taking care of our patients with the thyroid eye disease. Yeah.
Thank you, Dr. Vrunda. I think Cindy has a question in the chat box. So Cindy, to answer your question is, if a question has been validated in say 2 or more, is there a need for the validation for a particular population? So Cindy, now this questionnaire, for example, if you take the GoQL questionnaire, which has been validated by 9 groups, it is all in different populations. Now the thing with disease, it has a lot of the way it presents, and the way even patients are different. Hi David. So Indian population, the spectrum of thyroid disease that we see here is quite different from what the Europeans see. To give you an example, there is a lot of hyperthyroidism associated with Graves' ophthalmopathy patients or thyroid eye disease patients in the Caucasian population. But in Indian population or in the Asian population, it is more of euthyroidism along with hypothyroidism population, which is almost, at par or maybe slightly more than the hyperthyroid population. So that is just an example. Again, eyelid retraction is more common in upper eyelid retraction is more common in the Western population. But what we have seen here is that the lower eyelid population is more common than the upper eyelid population. And this is also been seen in the Asians, the Southeast Asians. And proptosis is more common here. So those kinds of differences are there. So if we need to bring in that, the lifestyle of the patients are also different. For example, when the GoQL questionnaire was first made, the first question in the first part is, how easy is it for you to cycle?
Mm-hmm.
But, how many of us here in India actually, cycle to work or things like that? So those are the lifestyle differences which are there. So it would be nicer, it would be more applicable if that same questionnaire, if you are applying in your particular population, then you validate that, because it has to reflect what is actually happening in the population. I hope that answers your question, Cindy. Anybody has any comments, anything to add?
And Dr. Vashefa, I was just wondering,
Yeah.
because noticing that these questionnaires are based on a patient's feeling or satisfaction, won't it mislead you sometimes in how you're going to plan your patient management? In most cases, just most patients are not really satisfied with almost anything. They just want to look as perfect as they were before. So won't that mislead you in some way as to what you get on their questionnaires?
Okay. So now these questionnaires, how they're given is, you give them before you start any treatment. Okay.
Mm-hmm.
And there is this one study by Dr. Dolman where they have compared the questionnaire before treatment and after treatment. Okay. Now, because you don't have to be misled by what these questionnaires are telling you, you have all these measures of reliability and validity and all that. And what they have found is, they divided their set of patients into 3 groups. One who underwent decompression surgery, one who underwent a strabismus surgery, and the third group, patients who had, adjustments in the palpebral aperture. I mean, basically who underwent eyelid surgeries. So what they found was there was a statistically significant difference in the preoperative and the postoperative quality of life questionnaire score in patients who underwent a strabismus surgery or who had an intervention for the double vision. So now, if you see, double vision is the most troublesome because it not only has an appearance, it's not only a problem in terms of an appearance, but also in terms of functionality. You have double vision, you're really disabled. You really cannot do most of your, work life, work. So there, the intervention has really shown that a patient is unhappy with his disease. It shows it in his QOL questionnaire, and then he undergoes one intervention, and then post-intervention he is better. So that again reflects in his questionnaire. So quality of life questionnaire is basically to aid. You have your severity and your activity. Plus, you also have this quality of life questionnaire to guide you in the treatment. Now I'll give you another example. Suppose there is a 25-year-old young woman who has a very mild disease, but she has an upper eyelid retraction. Now, you know that age group, they are really, you know, conscious of their looks, or
Yes.
maybe because of their profession, if at all she is an actor, then she is definitely going to be, you know, bothered with that upper eyelid retraction which she's developing. So there, her quality of life is getting affected a lot. You know, psychosocially she is affected more, though she wouldn't be having any visual problems. So you decide to intervene there. You can give her the options of, you know, some Botox in the upper eyelid so that it's down. So you can take such measures. So that is how a quality of life questionnaire can aid you in your intervention or aid you in your patient management. Suppose that upper eyelid retraction wasn't very bothersome for the patient, then probably would have just, you know, advised her some topical lubricating drops and just be done with it, and, you know, call her at every 3 months and then take your measurements and just assess her. But because it was affecting her work or her psychosocial dimension so much, you had to intervene with a Botox. So this is another example of, you know, how it helps in management.
Okay. Thank you.
You're welcome.
Excuse me, Bashita. So I wanted to find out in your daily practice how you apply some of these questionnaires when you're having a clinic for thyroid eye disease. I know you don't have specifically a thyroid eye clinic, but you have a mixture. Could you specifically try to apply some of these principles?
Yes, thanks for that question. So, well, we don't have a questionnaire per se. We do have it as a part of our, you know, the daily clinical routine thing. I mean, but we have not yet converted into our native language, or we don't give the questionnaire, a hard copy of the questionnaire to the patient to fill it. So it is more of, you know, understanding the psyche of the patient, the psychology of the patient, and deciding the further management in discussion with the patient. Like the example I just mentioned of a 25-year-old woman. So it is more in those lines, but definitely we are trying to pursue, you know, having a proper QOL converted to our native language, which can be applied and later validated, and see how, you know, how the Indian population, how they kind of respond, or how their quality of life is getting better or worse with the interventions.
Okay, thank you. Do you have any questions, any contributions so far?
Was that for me?
No, I'm asking if there are any contributions from the rest of the participants.
Yes, moderator. So I was reading the article. Are you getting me?
Yes.
Hello? Yeah, so I was reading the article, and it was a long article, but I think the presenter has done justice to it, and I'm sure together with your help, it's more clear now. And I've seen sitting in the clinic how we see patients come. You even have registrars they present, and most of the time you end up treating what actually they didn't come for, because
Exactly.
very few times we ask the patients how they are feeling and what really brought them to the hospital. If it's a thyroid eye patient, you just say this patient is at stage what, so the standard treatment is this, and we go with that. But with this discussion, you can see patients are different. I think whatever disease they are suffering from, and they will actually pinpoint to you what they have come from. And you see that, like the presenter said, if we are looking at the quality of life, even after we have put in an intervention or as a patient comes. Many times patients come with symptoms of dry eye and we end up doing their cataract surgery because that's what we concentrated on. But this patient came with a completely different thing. So I think this highlights the fact that we need to analyze patients more and actually go personally and see why the patients come to the clinic and what problems they are presenting with, not just in thyroid eye disease, but other diseases also. Thank you.
Very valid points. Thank you. Thank you so much.
It's interesting points, Dr. Mboni, that you have raised. Many times also just in different clinics, if patient comes to my clinic, I'm more concerned on what I've seen or what the diagnosis is written there, and I completely forget what the patient is actually complaining of. And then sometimes I get amazed at the end of the day after having explained, the patient still seems not satisfied, like you have not done anything, and yet you did so much on that patient. So I think it's a very, very important point that we can apply in all aspects in our clinic, not only thyroid eye disease.
Very true. Very true.
Okay. I'm not seeing any questions either in the chat box or questions coming up. I think we should be ending for now. I would like to thank specifically the moderator and also the presenter. Indeed, this was quite challenging article, especially we are used with articles or studies that are able to point out maybe surgical interventions or maybe in clinical interventions, but not specifically something to do with maybe, I don't know, I can call it like a humanities type of questions. Yeah, so it's really very difficult. Sometimes we are thrown off guard, but amazingly, I think I admire the presenter did a lot of work. I know how challenging it was, but I think it was good practice and also with the guidance of the moderator. Please keep it up and thank you very much.
Thank you.
Thank you. Judith did a wonderful, wonderful job.
Okay, yeah. So if there's nothing more, we call it a day. Thank you, everyone. You can join us next week for another, we will communicate the next topic next week.
Thank
Bye.
you so much. Thank you for having me.
Okay, thank you.